Good day everyone! In this video, our group will be sharing to you about the art therapy, dance therapy, music therapy, and the attitude therapy. If you want to learn more about this video, please do keep on watching. Let's start with art therapy. The use of artistic methods to treat psychological disorders and enhance mental health is known as art therapy. Art therapy is a technique rooted in the idea that creative expression can foster healing and mental well-being. Art, either creating it or viewing others' art, is used to help people explore emotions, develop self-awareness, cope with stress, boost self-esteem, and work on social skills. Techniques used in art therapy can include drawing, painting, coloring, sculpturing, or collage. As clients create art, they may analyze what they have made and how it makes them feel. Through exploring their art, people can look for themes and conflicts that may be affecting their thoughts, emotions, and behaviors. Art therapy can be used to treat a wide range of mental disorders and psychological distress. In many cases, it might be used in conjunction with other psychotherapy techniques such as group therapy or cognitive behavioral therapy.
Some situations in which art therapy might be utilized include
adults experiencing severe stress, children suffering from behavioral or social problems at school or at home, children or adults who have experienced a traumatic event, children with learning disabilities, individuals suffering from a brain injury, and those people experiencing mental health problems.
some conditions that art therapy may be used to treat include
aging-related issues, anxiety, depression, stress, emotional difficulties, cancer, eating disorders, family relationship problems, or any relationship problems, psychosocial issues, medical conditions, and substance use.
In more recent years, researchers have explored the benefits of art therapy for treating a variety of physical health difficulties. Some of their findings show art therapy help reduce pain, decrease symptoms of stress, and improved quality of life in adult cancer patients. Improved ability to deal with pain and other frightening symptoms in children with cancer. Reduced stress and anxiety in children with asthma. Stimulated mental function in older adults with dementia. Indicated a reduction in depression in Parkinson's patients. The goal of art therapy is to utilize the creative process to help people explore self-expression and in doing so, find new ways to gain personal insight and develop new coping skills. The roles of the nurse are to provide materials needed to make paintings, drawings, sculptures, and other types of artwork. This type of therapy may help the patient or client express his or her feelings through art. The art is then used to help talk about their emotions and concerns. The nurse also provides support to patients in doing tasks given by the therapist. And lastly, the nurse also plans for scheduled therapy time.
What is dance therapy? Dance therapy uses movement to improve mental and physical well-being. It's a recognized form of complementary therapy used in hospitals and comprehensive clinical centers. Several studies suggest that dance therapy helps people do the following: develop positive body image, improve self-concept and self-esteem, reduce stress, anxiety, and depression, decrease isolation, chronic pain, and body tension, increase communication skills, and encourage a sense of well-being. The physical benefits of dance therapy as exercise are well documented. Experts have shown that physical activity increases special neurotransmitter substances in the brain. This creates a state of well-being, and total body movement such as dance enhances the functions of other body systems too. These include circulatory, respiratory, skeletal, and muscular systems. Dance therapy can help you stay physically fit and enjoy the pleasure of creating rhythmic motions with your body.
The key principles of dance therapy are body and mind are interconnected so that change in one impacts the other. Movement can express aspects of the personality. Part of the therapeutic relationship is communicated through nonverbal means. Movements can be symbolic and can represent unconscious material or processes. Movement, improvisation, or experimentation can bring about new ways of being. The goals of dance therapy is to promote insight, integration, and well-being, and as well to diminish undesirable symptoms in various clinical populations. The role of the nurse is to interview, assess patient emotional, physical, psychosocial state, and activity level, or holistic well-being in general. Plan for scheduled dance therapy time, provide encouragement to client in doing the therapy, and assess client's mental well-being throughout the sessions.
Music therapy uses music to promote healing and enhance quality of life. It is a form of complementary therapy, and it helps patients cope mentally and physically with their diagnosis. Music therapy may involve listening to music, making music, singing, and discussing music, along with guided imagery with music. Music therapists believe that our muscles, including the heart muscle, synchronize to the beat of the music, and this music can slow a heart that is beating too fast. Furthermore, it is believed that self-expression in music therapy can reveal subconscious thoughts and feelings, and it can be therapeutic in the same way psychotherapy has shown to be therapeutic.
Music can help with the following. First, to ease stress, apprehension, and fear. Second, to improve mood. Third, to lower heart rate, blood pressure, and breathing rate. Fourth, to ease depression. Fifth, to ease sleeplessness. And sixth, to ease muscle tension and provide relaxation. The goal of music therapy, it aims to promote self-expression, mood management, and growth in the patient. The role of a nurse, it includes music therapy as an intervention to promote therapeutic effect for a patient. A nurse can become familiar with music therapy and function as co-therapist to help patients using music as a medium.
What is attitude therapy?
Attitude indicates set of feelings, faith, and behavior at individual or incident. These are 4 types of attitude: positive, neutral, second, and negative. Attitude represents our personality. If we show a negative attitude towards others, it will express the harmful nature of the individuals. Attitude is that what someone feels towards one individual that he is experiencing. The attitude of other people towards us is showing the behavior or action. There are 5 types of attitude therapy. First is kind firmness. This is used on people who are depressed and uncooperative. Therapists must stand their ground and tell them they won't listen to them when they talk negatively. Second is no demand approach. It is used on people that is out of control. Therapist needs to show caring behavior to show the person they won't hurt them. When they get out of control, the therapist does nothing but just come back to them later. Third is active friendliness. Used on people that have withdrawn. Give them a reason to want to be active and not withdraw. And also, this needs the therapist to be very verbally supportive.
Next is passive friendliness. It is used on people that have distrust with others. Therapists need to make it very obvious they are always available. Pick an activity for them to engage in that they will be immediately successful in. Next is the matter of fact. It is used on irresponsible and manipulative people. The therapist has to state and stick to what they say and not deviate from what they say. So the goal of attitude therapy is to convert a person's negative attitude to positive attitude through the change of behavior and belief by different techniques. So the roles of the nurse here in the attitude therapy is to interview to assess patient and client emotionally and psychosocial state and activity level. Involve the family members in the attitude therapy. Plan for a scheduled therapy time. Impose direct, clear, and confident role to the patient. Do not give false reassurance to the patient. Lastly, non-judgmental behavior must be practiced.
The therapies presented aim to improve the quality of life of any individual and serve as a vehicle for elevating the burden, especially to those who suffer from mental illness, as it provides the avenue for the person to look deeper into his or her problems and unhealthy habits, and a better understanding of certain aspects of themselves. Through music engagement, visual arts therapy, movement-based creative expression, and positive attitude, with the contribution of technically trained experts and practically present, people who suffered will receive the right indication, a greater courage and enthusiasm to arrive at his or her own time, in small steps to give vent to impulses such as anger, frustration, fear, and suffering, shrugging off the negative emotion to project it contingent on the paper, on canvas, on artistic support. When people are invited to work with creative and artistic processes that affect more than their identity with illness, they are more able to create congruence between their affective states and their conceptual sense-making. Through creativity and imagination, we find our identity in our reservoir of healing. The more we understand the relationship between creative expression and healing, the more we will discover the healing power of the arts. Everyone has emotional challenges. In today's era, solutions are available to more people than ever. No one needs to suffer alone.
So that ends our video presentation. We hope you guys learned something and thank you so much for watching.